So, Dr. Chiranjeev, this is Prarthana from the Sentinel Digital Desk.
Hi, Pratna. Yeah.
Hi. So, you are very much aware of the fact that the air pollution in Guwahati is really creating havoc for a lot of people, for the population of the city, but
Yes.
especially the young kids. Children, they are very much affected as per some reports that's coming in, and we understand that at least 35 kids have been admitted in the Guwahati Medical College Hospital, and they are facing a lot of respiratory issues. So, what is your take on this? How do the citizens of the city they keep their children safe from such air pollution issues?
Yeah, actually, now the report of this, like 35 children, was only, I think, a few days back. But we have been like over this season, the last like few weeks, or I would say like since the month of January, we've been getting a lot of like difficult to treat wheezing children in our OPDs, and some patients have to be admitted indoors also, because the now that the talk is about the 2.5. We're talking about the air pollution index in Guwahati is 2.5, right? So the
Yeah.
particle size that reaches 2.5 is like very small. It easily goes through our like upper airways and gets deposited into our lungs, which causes a plethora of like inflammation. At first, it causes irritation. After
Okay.
it leads to the inflammation, the mucosa becomes swelled up, and there's a lot of secretions, and due to which the children have difficulty in breathing because the airway is filled up with secretions and inflammatory particles. So, like bronchial asthma, we already have known that air pollution is always implicated with rising incidence of bronchial asthma. So, lot of the previous cases, they are also coming, and we are getting a lot of new cases of bronchial asthma also, who have attended our OPD in the last, course of the last few weeks, and they've been very difficult to treat.
Okay.
Uh, and not just that, even there has been a rise in viral and bacterial pneumonias also, because the link between the rise in infection and the air pollution, we are still doing a research on it, but because there is already there's a link is there, that because respiratory problems are more in children, so the chances are that the infections will also be part of the whole picture. Yeah.
Okay, so you said you are getting a lot of cases from children who have
Yes.
come to you, and parents have come to you to complain about the certain issues, health issues that their kids are facing. So, what is your advice, or what is your what kind of advice would you give it to the people who have kids and who want to keep them safe from such kind of issues or such kind of disease?
Uh, well, actually, it's just the children that we get, they're just the tip of the iceberg. There are a lot of other children who have been suffering there, like having like mild allergy. They don't come to the school hospital yet, but they're like there's been rise of like school absenteeism. A lot of children are missing classes, they're missing school because of this like respiratory disorders. So it begins from like from a preventive perspective. We have to like think of a in a broad spectrum. We have to think just because treating a child and like again sending them home, it's not enough. A lot
Okay.
of these children, they don't even come to like the OPD. They're like they're not well, they're sick, so they'll just be at home. They're not going to be able to play. They're not going to be able to attend the school. So it affects the quality of life, because this is the growing period of the children's life, and this is just a short term, or whatever we are seeing is that the rising the bronchial asthma cases, respiratory disorders. But a long term picture is also that when these particles they reaches our terminal bronchioles, which is the lungs, some of them also they enter the bloodstream. And long-term researchers have shown that these children they are more prone to develop cancers. They're more prone to develop chronic obstructive pulmonary disorders. Even immune system function also has like been reported to have been affected due to this air pollution. So this is not a like observational one cross section that we will just deal with this problem now. We have to like think of it is in a more holistic point of view. Our children who come to us in the OPDs, we usually we ask them to wear masks or like stay indoors, and whoever can afford, then maybe they can have a air filter installed in their homes. But But that's just one way of looking at it. If
Okay.
you look at a bigger picture, we have to really think about the pollution, the rise in pollution in Guwahati city over the last few years. Ever since COVID epidemic was over, the pollution and the number of vehicles and emissions in Guwahati is so huge. It's not just children's. Even we are able to see. Whenever we look at the sky, we see it's so dark.
Absolutely.
Initially,
Yes.
we thought,
Yes.
it was just the
Yeah.
dust, but it's not. It's more than just the dust. It's the pollution. So the whole idea of going green, using recycled energy, that we also have to start looking at that perspective, because we are looking at the future now. This problem is not just going to be dealt with by giving medicines to children one time and sending them home. We have to think about, because this is going to keep coming to us unless we look at it with a broader perspective. So I just think that we need to work as a team with the policymakers also, and think about how to bring the pollution levels down in the Guwahati city, given all these emission norms and everything is going on. But we still see so many vehicles causing air pollution, because the nitrous oxide, the traffic pollution, basically the nitrous oxide is the most damaging irritant in the airways, which is causing all these problems. So that we have to address in the long term.
Thank you so much on that note for giving us such important and vital, issues and speaking so much on this. Thank you so much on that note. Thank you. Really appreciate it.